Did you know that many hospital claims are denied due to non-compliance of standard of care? Most doctors and hospitals go about it the wrong way. So I want to make sure that by the end of this video, your hospital will have an idea on how to prevent denials of your hospital claim due to non-compliance of standard of care. Denial of hospital claims due to standard of care was an all-time high last year due to the implementation of Philhealth Medical Pre-Payment Review. This is popularly known as the Claim Form 4. So, the Claim Form 4 is a summary of the patient's pertinent clinical information during the time of confinement. Now, the key word here is pertinent, meaning having relevance to the patient's clinical state. Just provide Philhealth the pertinent information, then your claims will be paid. So here's the tip. The so-called pertinent information must be aligned with standard of care. So, what is standard of care? Now, this is the treatment that is accepted by medical experts as the proper treatment for a certain type of disease that is widely used by healthcare professionals. Now, why is there a need for standard of care? Now, Philhealth, being an insurance corporation, will naturally impose standards as indicators of quality care prior to payment. Now, this means Philhealth will pay reimbursement and at the same time will expect quality services for their patients. It may seem so basic, but believe it or not, many do not get this. Let us begin. First, document patient's medical necessity for admission or the indication for surgery. Now, I have stressed this in my previous video on Philhealth Medical Audit. I will emphasize it once more. Philhealth is fixated on the clinical necessity for admission or the indication for surgery. Now, these are basically patient signs and symptoms that will warrant admission of the patient. These are signs and symptoms that will compel the patient to seek surgery. So, let us make a hypothetical scenario. You have 3 patients in the emergency room. Patient 1 has community-acquired pneumonia, moderate risk. Patient number 2 has urinary tract infection. Patient number 3 has acute gastroenteritis with moderate dehydration. So, before admitting the patient, you need to ask yourself these questions. Based on your history, the physical exam that was gathered, are patient's clinical signs and symptoms enough to warrant admission? In cases for surgery, are the signs and symptoms of the patient a justifiable reason as indication for surgery? So you must extract this from your patients. If there is no compelling reason to admit the patient, then do not admit the patient. Treat it as an outpatient case. However, if there is valid reason for admission or a valid reason for surgery, then admit the patient. Take note, let us say the patient needs admission and your hospital can provide the services. Make sure the admitting doctors write, encode, document, transcribe, or indicate in the chart the valid signs and symptoms or the medical necessity to admit the patient. The information must be seen in the chart and in the Claim Form 4. Now, if your admitting doctor will write a 2-sentence medical history or writes down unremarkable in the history and physical exam form of your clinical chart, then expect your claims will be denied. If the signs and symptoms is not reflected in the claim form 4, or let us say the claim form 4 is incomplete, then the claim is denied. Now, let's proceed to the next topic. Clinical management must be aligned with clinical practice guideline or Philhealth quality policy statement. In my last video on Philhealth claims audit, I borrowed the definition of clinical practice guideline as a document with the aim of guiding decision and criteria regarding diagnosis, management, and treatment of patients in specific areas of healthcare. Now, it is intended to optimize patient care that are informed in a systematic review of evidence and an assessment of the benefits and the harm of the alternative care options. So, Philhealth understands that the CPGs are mere recommendations. They are not expecting 100% compliance on what is written in the guidelines. What Philhealth is expecting from you guys is the responsible way of consistently meeting the current medical standards that will benefit the patient clinically. Now, this means the management and treatment is within standards. Now, these are just simple guide questions that will help you navigate on how to relate the clinical practice guideline with claims processing. Now, going back to our discussion on community-acquired pneumonia, moderate risk, urinary tract infection, AGE with moderate dehydration. So, what are the lab exams or diagnostics necessary to treat the illness? Is there a gold standard in terms of laboratory exam or diagnostics? So you need to consider this. Next, what is the treatment of choice for this kind of infection? You need to take note of this. So the next question, how many days should you treat this infection to more or less guarantee optimum care of the patient? Now, Philhealth is very sensitive on this. Again, please take note, whatever lab exam or diagnostic exam you requested, you need to have a lab result. So, Philhealth wants to see the result, be it a hard copy document or a soft copy document. Now, the same applies with treatment. Philhealth wants to see it in the chart as well as in the claim form 4. Order it, document in the chart, make sure the results are complete, and all must reflect in the claim form 4. So, this will bring us to the last part, completeness of the claim form 4. So, let us say your patient is really sick. Then, your team of doctors and nurses provided care. Then the patient recovered and was sent home. Congratulations! Unfortunately, it will not end there. Now, if your hospital cannot comply with the completeness of the claim form 4, then your claims will still be denied even if you have successfully treated the patient. So, completeness of the claim form 4 has 2 requirements. First requirement, claim form 4 must be filled out and it must be legible. Now, legibility is not an issue anymore. However, all necessary fields must be filled out. Bear in mind that the claim form 4 is a clinical document. If your patient has fever, make sure it is indicated there. If the patient has abdominal pain, make sure it's indicated there. Now, if the first case rate is, be it CAP-MR, urinary tract infection, or the AGE, make sure clinical information is complete and consistent. Now, the second requirement, all additional documents must be complete. So what does this mean? If your patient has pneumonia, make sure you have the chest x-ray result as recommended in the clinical practice guideline. If it is urinary tract infection, you must have the urinalysis result. If it's AGE, fecalysis result must be in place. Now, if you have dengue, CBC or platelet count must also be attached. If the patient has congestive heart failure, then necessary labs must also be attached. Basically, labs and imaging results must be attached. So, if it is surgery performed, operative technique must be present. So, if possible, you also need to attach the medication sheet to prove standard medication were given. Now, please take note that by submitting the necessary documents is a proof that services were performed. Absence or incomplete of the documents will result in the denial or the return of your claim. So the three ways to prevent denial of claim due to non-compliance with the standard of care are the following. Document patient's medical necessity for admission or indication of surgery. The clinical management must be aligned with CPG or Philhealth quality policy statements. Completeness of claim Form 4 is required. For related discussion, please check the next video, Philhealth Claims Medical Audit. This is Coach Doc Ben. See you in the next session.